Welcome to the Naumina Library. Thank you for opening the Ischemic Heart Disease module. Together, we will explore and explain the following topics regarding the most prevalent cardiovascular disease, ischemic heart disease. Definition and epidemiology. Mechanism of the disease. Symptoms. Risk factors. And interventions. Let's begin our exploration of ischemic heart disease with the definition. Ischemic heart disease or coronary artery disease is the disease of the blood vessels or coronary arteries supplying the heart muscle with oxygen and nutrients. Ischemic heart disease or coronary artery disease is a pathological process characterized by atherosclerotic plaque accumulation in the epicardial arteries, whether obstructive or non-obstructive. The disease can have long, stable periods but can also become unstable at any time, typically due to an acute atherothrombotic event caused by plaque rupture or erosion. Let's explore the events leading to plaque rupture. Atherosclerosis is the disease of the tunica intima of the blood vessels. It usually affects the coronary arteries of the left ventricle. Since ischemic heart disease is characterized by the accumulation of the plaque in the coronary arteries, let's zoom into a coronary artery and observe the entire process, step by step. Looking through a section of the coronary artery, we can observe the lumen of the vessel, lined with a stratum of endothelial cells. Between the endothelial cells and the smooth muscle cells of the tunica media is the tunica intima. The outer layer of the artery is the tunica externa. If we magnify this section of the blood vessel wall, we will clearly observe the endothelial layer, the tunica intima and the tunica media, comprised of vascular smooth muscle cells. Due to endothelial damage, the lesion initiation is triggered and the accumulation of the plaque is initiated. If we zoom into this small section of the plaque, we will be able to observe the endothelial layer, the tunica media, the tunica intima and the infiltration of immune cells and lipoproteins. Due to endothelial damage, the LDL infiltration and oxidation started, leading to monocyte recruitment. These processes lead to the next step in the progression of atherosclerosis, fatty streak. Zooming into a cross-section of the fatty streak will allow us to observe the main components of the plaque at this stage of the disease. We will observe the endothelial layer, the intima, the media, the infiltration of immune cells and lipoproteins, the presence of foam cells, migrated smooth muscle cells and the initiation of necrosis. This stage is characterized by foam cell formation, vascular smooth muscle cells migration and proliferation and an overall inflammatory environment. The next stage of the disease is called fibrous plaque. Let's examine the contents of the plaque by magnifying another cross-section, which will allow us to closely observe the endothelial layer, the tunica media, the immune cells and lipoproteins, the abundance of foam cells, the necrotic core and the migrated muscular cells. This stage is characterized by the formation of the fibrous cap, matrix synthesis, apoptosis and necrosis and the subsequential activation of metalloproteinases or MMPs. The MMPs will slowly degrade the collagen fibrous cap, destabilizing the plaque and leading to ruptures. The final stage of atherosclerosis is characterized by a plaque with very similar components with the fibrous plaque, namely a necrotic core, fibrous cap, the tunica media, foam cells and the rupture itself. Due to the rupture, the thrombogenic core is exposed to the blood circulation leading to the activation of the coagulation cascade, the thrombus formation and the thromboembolic event. To summarize, there are 4 stages of atherosclerosis: lesion initiation, fatty streak, fibrous plaque and plaque rupture. Due to specific risk factors which we will explore in the next sections, the endothelial layer of the healthy artery is damaged, leading to lesion initiation, LDL infiltration and oxidation and monocyte recruitment. The plaque will progress to the next stage, the fatty streak. This stage consists in foam cell formation, vascular smooth muscle cells migration and proliferation and an overall inflammatory environment. The third stage of atherosclerosis is the fibrous plaque with the fibrous cap formation due to endothelial cell matrix synthesis. Also, at this stage necrosis starts to develop, along with the activation of metalloproteinases. The activation of MMPs will eat the fibrous cap, leading to the rupturing of the plaque, with the exposure of the thrombogenic core and the activation of the coagulation cascade and thrombus formation. If the thrombus forms inside the coronary arteries, it can lead to a myocardial infarction, also known as a heart attack, a potentially fatal event. A thromboembolic event causes a decreased or complete cessation of blood flow to a portion of the myocardium. Myocardial infarction may be silent and go undetected, or it could be a catastrophic event leading to hemodynamic deterioration and sudden death.